What if, like, a treatment they're testing for, uh, let's say a brain disease, could unexpectedly turn out to be a total game changer for something completely different? You know, a disease affecting a bunch of different organs all over the body. That's kind of what we're diving into today.
Yeah, definitely.
Welcome to the deep dive, by the way. You're here because you want to get to the heart of complex topics, like quickly and thoroughly,
Exactly.
and we're all about that. Today, we've got this super interesting clinical trial protocol we're going to dig into, and we're going to pull out all the juicy insights just for you.
That's right. We're taking a deep dive into this study called Inebilizumab for treatment of IgG4-related disease. It was published in the New England Journal of Medicine, so,
Sure.
pretty legit. It lays out, like, this whole detailed plan for a big research project looking into a possible new treatment.
Okay, Inebilizumab.
Yeah.
Sounds a little intimidating, I gotta say. So break it down for us.
Sure.
What is this thing, and why should we, like, care?
So inebilizumab is, it's the investigational product. It's the potential treatment they're studying. And what makes it really interesting is what it actually targets. It goes after this protein called CD19, which is found on B cells. And B cells, well, those are like these key players in our immune system.
Oh, yeah, B cells. I've heard of those.
Right. But here's the thing. This isn't like the first time inebilizumab has been, in the spotlight.
Right, it's been looked at for MS, right. Multiple sclerosis.
Exactly. And there's this phase 1 study, kind of like an initial safety check. They were basically trying to figure out how well patients tolerate it at different doses.
Oh, okay. Like, is this thing safe?
Exactly.
Yeah.
And overall, it turned out to be pretty well tolerated. The main side effects they saw were like things you might expect with an infusion. Maybe a little headache, feeling a bit icky during the infusion itself, and then like some sniffles, maybe a cough. Pretty common cold type stuff.
Yeah.
But that's where things get interesting.
Ooh, a plot twist.
Right. So while the MS study was mostly about safety, they also noticed something else.
Okay.
They saw that some of the people getting inebilizumab seemed to have fewer new lesions on their MRI scans. And those lesions, they're kind of a hallmark of MS, so, that was a pretty big deal.
Interesting. So less damage, potentially.
Yeah, potentially.
Yeah.
But, like, to be clear, that wasn't the main focus of that early study, so we can't jump to conclusions just yet. But it definitely raised some eyebrows, and it made them want to dig deeper and see what this drug might really be capable of.
Okay. Yeah, that makes sense.
So that's where the shift to looking at it for IgG4-related disease comes in.
Right. IgG4-related disease. Okay, so remind me again. What exactly is that? And, like, why would a drug that showed promise for MS be relevant here?
So IG4-RD, that's what they often call it for short. It's basically a condition where your immune system kind of goes a little off the rails. It causes inflammation that can affect a whole bunch of organs all over your body. It's not picky.
Wow.
Yeah. Like almost any organ can be affected. The pancreas, kidneys, salivary glands, you name it, it can show up there.
Oh.
And because it can affect so many different places, it used to be really tough to diagnose.
Oh, I bet.
Yeah, for a long time it was kind of a mystery. But then in 2019, the American College of Rheumatology, that's ACR, and the European League Against Rheumatism, EULR, they teamed up and created these classification criteria.
Okay.
And that was huge. It gave doctors and researchers this, like, more consistent way to identify the condition.
Highly.
Got it.
So that brings us to this mitigate trial. What's the big question they're trying to answer with this study?
So the main goal of mitigate is to see if inebilizumab can, effectively and safely reduce the risk of these things called disease flares in people who have IgG4-RD.
Disease flares.
Yeah, like flare-ups. So the current treatments, things like glucocorticoids, which are basically steroid medications, they can help control the inflammation, at least initially. But the problem is that even after that initial treatment, these flares are super common. They can be really painful and lead to more organ damage, and they can just make life really hard for people with this condition.
So it's like, even if you treat it, it can keep coming back.
Right. And on top of that, long-term steroid use has a bunch of nasty side effects. So finding a way to, like, stop those flares from happening in the first place, that's a major goal in managing this disease.
Got it. So they saw this drug working on B cells and MS. They noticed it might have some benefit there. And now they're wondering if targeting those same B cells in a different autoimmune condition, IgG4-RD, could stop those recurring flares.
Exactly. That's the beauty of scientific discovery, right? You find something that works in one place, and it can lead to all sorts of new possibilities in other areas.
It's like, hey, this tool we made for this job, it might actually work over here too.
Exactly. And that's what makes it so exciting. So today, we're not only going to break down the mitigate trial, but we'll also take you behind the scenes and show you how they actually structure a phase 3 clinical trial to make sure they're getting solid, reliable answers about whether a treatment really works.
Ooh, I like that. Behind the scenes.
Right. So just to give you the basics, this is a phase 3 trial, which means it's a pretty big deal. It's large scale, lots of people involved. They're trying to confirm if the drug really works in a big, diverse group. And it's randomized, meaning people are assigned to different treatment groups purely by chance, like flipping a coin. And it's double-blind, which means neither the patients nor the doctors know who's getting the real drug and who's getting the placebo. And on top of that, it's happening at multiple medical centers all over the place, which is really important because it helps make sure the findings apply to a wider range of people.
Okay, so that's the setup. Now, what are they hoping to see? Like, what's the big win they're looking for in this trial?
The main thing they're hoping to see, the primary objective, is to find out if Inebilizumab can actually reduce the risk of those IgG4-RD flare-ups.
Okay.
How they're actually measuring this is by looking at how long it takes for someone in the trial to experience their first flare-up. But there's a catch, right?
Oh.
It has to be a flare-up that required treatment and was confirmed by something called the adjudication committee.
Okay, an adjudication committee sounds serious.
Right, but it's all about making sure the results are, like, super objective.
Oh, okay.
So here's how it works. Let's say one of the doctors in the study thinks a participant is having a flare-up. They'll, look into it and decide if the person needs treatment. But at the same time, they also send all that info to this independent group, this adjudication committee. And these guys are like the experts. They're totally separate from the study doctors. And they don't know who got the real drug and who got the placebo.
Ooh, sneaky.
Right. So they basically review the case and decide if it really meets the strict definition of a flare-up according to the rules laid out in the study protocol. It's like a second opinion, but from, like, the ultimate experts.
Makes sense. It takes the guesswork out of it, right?
Exactly. It just makes the results more reliable.
Okay, so that's the main goal. But they're hoping to learn some other stuff too, right?
Oh, yeah, totally. They've got these secondary objectives as well. First, they want to keep tabs on safety and see how well people tolerate Inebilizumab. But they're also looking at its effect on other aspects of the disease, not just flares.
Okay, give me some examples. What are they looking at?
Sure. One of the key things they're tracking is the what they call the annualized flare rate. That's basically how many flares someone has per year. But again, only the ones that need treatment and get that official nod from the adjudication committee. Another big one is how many people achieve what they call flare-free complete remission by the end of that 52-week period. And this is like the ideal scenario. I mean, someone has a score of 0 on this thing called the IgG4-RD responder index, which basically means no disease activity, plus no confirmed flares. And they don't need any more treatment other than that planned tapering off of the steroids they started with.
So basically, they're cured.
Well, it's not quite that simple, but it's definitely a very positive outcome.
Yeah, for sure.
They're also keeping track of how long it takes for the study doctors to decide someone needs treatment for, like, new or worsening disease activity, even if it doesn't technically meet the strict definition of a flare, according to the adjudication committee. And then they've got a bunch of what they call exploratory objectives and endpoints. These are like additional questions they're hoping to give some initial insights into.
Okay.
It's not the primary focus of the trial, but it just shows how much they're trying to learn from this study.
Yeah, that's cool. They're really squeezing every bit of information out of it. So we know what they're looking for, but what's the reason behind all of this? Why the study? Why now?
Good question. So the main reason they're doing this study is because of the limitations of the current treatments for IG4-RD. Like we said, glucocorticoids, those steroids, they can help in the beginning, but the flares, they're a huge problem.
Right, yeah, we talked about that.
And those repeated flares, they can really mess things up long term. Organ damage, the disease progressing, it's not good. And then, like we said, long-term steroid use. That comes with its own set of issues.
Ugh, yeah, steroids. Not fun.
So they really need to find something that can prevent those flares from happening in the first place. And that's where Inebilizumab comes in. They're testing whether it can be that preventative treatment.
Okay, that makes sense. So who are they looking for to participate in this study? Like, if I have IgG4-RD, can I sign up?
Well, not everyone qualifies. They have some specific criteria. First off, you got to be an adult, 18 years or older, and you need a confirmed diagnosis of IgG4-RD based on those 2019 ICRELR criteria we talked about earlier.
Okay.
And importantly, you got to have had recent active disease that required treatment with those glucocorticoids. And they're specifically looking for people who are considered to be at higher risk of having more flares. This often includes people who have multiple organs affected by the disease.
So basically, if you've been stable for a long time, you're probably not eligible.
Exactly. It's for people who are actively struggling with the disease.
Mm.
And the way they're designed the study, it actually incorporates the current standard of care. So everyone who participates, they'll have already received an initial course of glucocorticoids to treat their active disease.
Okay.
And they need to be able to tolerate a certain dose of those steroids when they enroll in the study. But then, during the study, everyone gets gradually tapered off those steroids over an 8-week period. This is important because they want to see if inebilizumab can work on its own without the steroids to keep the disease under control.
So it's not like they're giving Inebilizumab to people who haven't had any treatment. They're seeing if it can help maintain that remission after the initial treatment.
Exactly. And that's why the placebo group is so important. It lets them compare the effects of inebilizumab to what happens when people just taper off the steroids without any other treatment.
Okay, that makes sense. Now, flip side, who can't participate?
Right. There are some exclusion criteria. Some people just aren't eligible for the study. This is mostly for safety reasons. They want to make sure everyone who participates is as safe as possible, and they want to protect the integrity of the study results.
Okay.
So, for example, people with serious heart conditions, lung problems, or other major health issues that could interfere with the study or put them at risk, they wouldn't be eligible. Same goes for folks who've had an organ transplant or have a weakened immune system.
Okay.
Also, if someone has been treated with other drugs that deplete B cells, like rituximab, within a certain time frame before the study starts, they wouldn't be able to participate. That's because those previous treatments could mess with how inebilizumab works.
Makes sense.
Oh, and another important one. If the doctor doesn't think someone can safely reduce their steroid dose to a certain level within that initial 8-week period, they might not be eligible.
Okay.
There are some exceptions for people with specific conditions, like adrenal insufficiency, but that's decided on a case-by-case basis. And then, like with most clinical trials, pregnant or breastfeeding women and people who have recently gotten a live vaccine can't participate either.
So it's a pretty select group.
It is. They want to make sure they're studying the drug in the people who are most likely to benefit and who are least likely to experience problems.
Okay, so let's say I meet all the criteria and I get into the study. What happens next? Like, what's it actually like to be a participant?
Well, the first step is this thorough screening process. It can take up to 28 days before you actually get randomly assigned to a treatment group.
Wow, 28 days. That's like a whole month.
Yeah, it's pretty extensive. They got to make sure they're getting all the right information. So first, they'll explain the study in detail and get your informed consent, which basically means you understand what you're signing up for. They'll also ask you all about your medical history, give you a physical exam, check your vital signs like blood pressure and heart rate, and they'll do an electrocardiogram. That's the EKG or ECG, that thing where they stick all the electrodes on your chest.
Ah, yeah, the EKG. I've had one of those before.
Right. So they'll also do some imaging, usually a CT scan or an MRI to see what's going on with the IgG4-RD, and they'll use that IgG4-RD responder index to get a baseline measurement of your disease activity. And of course, they'll take blood and urine samples for all sorts of lab tests, including safety tests, a pregnancy test for women, and tests for infections like hepatitis B and C.
Okay, so they're really getting a complete picture of your health before they start anything.
Exactly. They want to make sure you're healthy enough to participate and that they understand where you're starting from. And then, once you pass all those screenings, it's time for the big reveal, randomization.
Dun.
Right, this is where they use that fancy system, the IXRS, the Interactive Voice Response System. It's basically a computer program that randomly assigns you to either the inebilizumab group or the placebo group. It's totally random, like flipping a coin. And it's designed to keep everyone in the dark, double-blind style. That means you don't know what you're getting, and the doctors don't know either.
Okay.
And the coolest part, even the company sponsoring the study doesn't know who's getting what until they're ready to analyze the results.
Yeah.
So it's super unbiased.
Wow, that's really impressive. So what about the treatment itself? How do they actually give you the Inebilizumab?
It's given as an intravenous infusion, basically an IV drip. But before each infusion, whether you're getting the real drug or the placebo, you'll get some pre-medication. It's usually a combination of a corticosteroid, an antihistamine, and something to reduce fever, like acetaminophen. This helps prevent any reactions you might have to the infusion itself.
Makes sense.
The infusion itself is given pretty slowly, and they gradually increase the rate over time. And then you hang out for at least an hour afterwards so they can monitor you and make sure you're okay. The study centers have all the trained staff and equipment they need to handle any emergencies, just in case.
That's good to know. Safety first.
Yeah.
So, how do they know if the treatment is working? And how do they figure out if someone's having one of those flare-ups during the study?
Right. So if a doctor thinks someone might be having a flare, they'll check to see if it meets the specific criteria in the study protocol. Remember that super detailed document we talked about earlier? They'll decide if the person needs treatment and send all the info to the adjudication committee, those independent experts we discussed earlier. And that committee, without knowing who got the real drug, reviews everything and makes the final call on whether it was truly a flare.
Got it. And they use that IgG4-RD responder index too, right?
Yeah.
To track how the disease is doing.
Exactly. They'll check that regularly to get a good overall picture of the disease activity in each participant.
Okay, cool. Now, safety. Obviously, that's super important in any trial. What kind of stuff do they do to make sure everyone's safe?
You're absolutely right. Safety is a top priority. So participants get regular safety checkups throughout the study. This includes checking their vital signs, weighing them, and doing physical exams. They also do regular blood and urine tests to check things like liver and kidney function, blood cell counts, and all sorts of other important stuff. And, of course, they're constantly monitoring for any side effects. If something serious happens, it has to be reported to the people running the study and to the regulatory authorities right away. They have strict guidelines for all of that.
Okay.
The study protocol also lays out specific reasons why someone might have to stop taking the drug, like a severe allergic reaction, a serious infection, if they get pregnant, or if they develop cancer. They're being super cautious.
Okay, that makes sense. So, what happens after that initial 52 weeks? The study doesn't just end, right?
You got it. So after that initial 52-week randomized controlled period, they have something called the open label period. It's a fancy way of saying that everyone who finished the first part of the study, regardless of whether they got Inebilizumab or the placebo, now has the option to get the real drug. So
Uh,
everyone gets a chance to potentially benefit. And then after the open label period, they have a safety follow-up period for the people who decide to stop taking the drug. They'll keep checking in with those folks for a while just to make sure everything's okay.
okay, so with all this data they're collecting, how do they make sense of it all? How do they figure out if inebilizumab is actually doing anything?
That's where the statisticians come in.
Yeah.
So the main analysis, they're going to compare how long it takes for the first confirmed flare-up to happen in the people who got the drug versus the people who got the placebo. And to do that, they'll use a fancy statistical method called a Cox proportional hazards model.
Okay, sounds complicated.
It is a bit, but basically it helps them see if there's a real statistically significant difference in the risk of having a flare between the two groups. They have to make sure the differences they're seeing aren't just due to random chance. They want solid evidence.
Okay, I get it. And what about those secondary endpoints we talked about earlier? How do they know if those are meaningful too?
So they've got a specific plan for that. They're going to use a statistical test called the Hawk-Bird procedure.
Uh-huh.
It basically helps them control for the possibility of getting false positive results when they analyze those secondary endpoints. It's like a safety net to make sure their conclusions are accurate.
Gotcha.
So they only consider a secondary endpoint to be statistically significant if the primary endpoint, the main goal of preventing flares, also showed a significant result. It's like they got to pass the first test before they can move on to the next one.
Makes sense. So it keeps them from getting too excited about a result that might not actually be real.
Exactly. They also plan to do something called subgroup analyses. That's where they look at the data within smaller groups of patients, like people who are newly diagnosed versus those who have the disease come back. That helps them see if the treatment works differently in different types of patients.
Okay.
Oh, and one more thing they'll be keeping an eye on is whether people develop antibodies against the drug. Sometimes your body can see a drug as a foreign invader and try to fight it off.
Mm.
And if that happens, it could affect how well the drug works and even cause safety issues. So they'll be checking for that too.
Wow, it sounds like they've thought of everything.
We're trying to be as thorough as possible.
Okay, so last but not least, ethics.
Right. Ethics are super important in any clinical trial. So this study is going to be run according to these international guidelines called Good Clinical Practice, or GCP. They're like the gold standard for making sure clinical research is ethical and scientifically sound. The study protocol has also been reviewed and approved by independent ethics committees at each of the hospitals or clinics participating in this study. These committees are responsible for protecting the rights and well-being of all the participants. And of course, before anyone can participate, They have to give informed consent. That means they fully understand what the study is about, the potential risks and benefits, and their rights as a participant. And all the data collected during the study is kept strictly confidential.
Okay, so it sounds like they're really doing everything by the book. So after taking this deep dive into the Mitigate trial protocol, what are the big takeaways?
The main thing to remember is that this trial is a really well-designed attempt to find out if inebilizumab can be a good treatment for preventing flares in people with IgG4-RD. The whole study, the way they choose the participants, all the assessments they're doing, it's all designed to get a clear answer to that question.
And I think it's so cool how this whole thing started with those unexpected findings in the MS study. It just shows you how, like, scientific exploration can lead to breakthroughs in totally different areas.
Absolutely. It's a great example of how interconnected everything is. They were looking at this drug for one autoimmune condition, and it might end up helping people with a completely different one. Who knows what other possibilities are out there?
It's a reminder that science is full of surprises.
Totally. And I think the whole thing with the adjudication committee is super interesting.
Yeah,
Having this independent group of experts review all the potential flare-ups just shows how committed they are to getting accurate and unbiased results.
definitely. Well, we hope this deep dive has helped you understand all the ins and outs of clinical research and the potential impact of studies like this on people living with IG4-related disease.
Yeah, it's amazing to see how much effort goes into these trials.
It really is.
Oh,
So as we wrap up, here's something to think about. We've talked about how the immune system plays a role in both MS and IG4-RD,
right.
and how the same drug might be effective for both. Do you think there might be other connections out there? Like, could this lead to new treatments for other autoimmune conditions?
That's a great question. It's definitely something to ponder.
It really is. If you're curious to learn more, we encourage you to check out some of the resources available online about IgG4-related disease, and maybe even explore some of the clinical trials that are currently underway in areas that interest you.
There's a whole world of research out there.
There is! Thanks for joining us on this deep dive. We'll see you next time.
So yeah.